Good afternoon, everyone. I'm Yifan Li, and I'm from Nanjing Medical University, China. And I'm pleased to share our project named Preliminary Funding or Pay-Forward Strategy to increase HPV vaccination rates among girls 15 to 18 in China. It's a pilot result study of a cluster randomized control trial. We declare no conflicts of interest. And as we know that HPV vaccine is the most cost-effective strategy to prevent from several HPV-related diseases like cervical cancer, anal cancer, and oral cancer, and genital warts, and so on. And however, in China, the overall uptake remains low, especially in age 9 to 14, the uptake is 4%, and among female age 9 to 45, it's 10%. And although there are several local governments provide public funding for the girls aged 13 to 40, there is no public funding for the girls aged 15 and above, and it's not easy to access to funded vaccination across different regions in China. And the findings from literature review and the quantitative interview of our team suggest that the key barrier to vaccine uptake in China include the first one is low awareness of cervical cancer and the HPV vaccine, and the low perceived risk of getting the HPV-related diseases, and the delay to initiate the vaccine and the vaccine hesitancy, and the lack of financial support. And this is a pay-forward model, and Tom have introduced this pay-forward model, and I have a brief introduction of this. Pay-forward means offer the participants a subsidized service. In our project, it's the subsidized HPV vaccine as a gift. And at the same time, we will provide the community engaged postcard, which conveys the health education information and the warm. And if they receive the health service, we will give the participants an opportunity to voluntarily donate to support the future participants to help them with the same service. And we have done the phase 1 project from July 2022 to June 2023. And the first figure on the left shows that the pay-forward strategy improved the HPV vaccine uptake compared to the standard of care arm, which is the double times. And the standard of care refers to the participants if they are willing to receive the vaccine, they need to pay it by themselves. And the secondary outcome, we say that the pay-for arm can have improved the second dose HPV vaccine uptake and the vaccine confidence. At the same time, the intervention decreased the vaccine delay compared to the standard of care arm. However, there are multiple components of pay-for model. There include the community engagement, postcards, health education, and financial components. So to better understand the contribution of each component, we designed a 3-arm trial. The arm 1 is the pay-forward and has all the components of pay-forward, and arm 2 is the subsidy focus arm, and arm 3 is the education focus arm. And this study, we aim to assess the preliminary effectiveness of different components of pay-forward model in increasing HPV vaccination among adolescent girls in China. And we conducted this trial in 9 high schools in China. Eligible participants are girls aged 15 to 18 years old and without HPV vaccination history paired with a caregiver. And schools are randomized in a 1:1:1 ratio across the 3 arms. And the 2 schools in Nanjing were allocated to the pay-for arm. The primary outcome of this study is the first dose of HPV vaccine uptake, which we verified by the vaccination invoice after 2 months follow-up, and the vaccine delay intention was assessed by the questionnaire. This is the baseline characteristics. Baseline characteristics were well balanced across 3 arms, and the average age of the girls is 16, and the average age of caregivers is 42 to 43. Most of caregivers are female with a high school or less education level, are married with a household income level of $11,600 per year, and they are aware, most of them are aware of HPV vaccines. And this is the primary outcome of our pilot cluster randomization trial. The pay-forward arm had a 44% of HPV vaccine uptake, and the subsidy-focused arm had a 46% uptake, and the education-focused arm was at the 16.4 uptake. There are no significant differences between the pay-forward arm and the subsidy-focused arm, as the table showed. The education-focused arm had a significantly lower uptake compared to a pay-forward arm. And this is the vaccine delay outcome. We also measured this outcome at baseline. Over 50 in each arm reported they would not get the vaccine immediately, even if the vaccine were available. And after the intervention, vaccine delay dropped by 9.7% in the pay-forward arm, 3.8 points in the subsidy-focused arm, and 16.5% in the education-focused arm. The decrease in both pay-forward arm and education-focused groups were statistically significant, and showing these 2 strategies were especially effective in encouraging people to get vaccinated without delay. And this is the summary part. We can say that both the pay-forward arm and the subsidy-focused arm significantly increase HPV vaccine uptake compared to the health education arm. And interestingly, interventions that include the community-based health education were effective in reducing caregivers' vaccine delay intention. And our key size is that financial support drives uptake action, while health education addresses behavior barriers. And next, we plan to validate this finding with a larger sample size to further examine the effectiveness and the potential scalability of each component. And that's all. This is our cooperated organization and the founder. Thanks for your attention.